Hello, everybody. This is Dr. Nelson from Central Florida. I'm having some technical difficulties. Here we go. Uh, and please don't mind the green screen. The program that we normally use is having some difficulties. And if I try to put my background, it's just going to kick me out, which is yesterday. If anyone was watching yesterday, Alia and I were kicked out several times. That was a problem. It's a problem with StreamYard. They haven't fixed it yet. So thank
They
you for
need to get
being
on the
here.
ball.
Thank you for being here. Please let us know where you're watching from. I am in Central Florida. Where are you, Cindy?
I am in Richmond, Kentucky.
Kentucky. Okay. So you're Eastern time as well, right?
Yes.
And just let us know where you're watching from. Thank you again for being here. And today we have Cindy Demand. I said it wrong this morning, by the way, but
You're good.
and
It's all good.
she's gonna share with us her story of healing. I call it stories of healing or metabolically healthy again. Anyways, I'd love to hear the story of many people reversing disease, multiple things, and we are together on this struggle because for many of us, it's not a one thing and done, right? We need to continue
Oh, yeah,
in this journey. So,
definitely.
uh, I do have your pictures. I'm gonna bring them on whenever you tell me, okay?
It,
And
whenever you want to, it doesn't matter. So, anyway, back in 2007, way before I started keto, I had gastric bypass surgery, which was the biggest mistake that I could ever have made. And, I've told so much about it on my channel, it's crazy. But a couple of years after that, I had started developing hypoglycemic episodes. If I ate carbs and didn't eat enough protein with it, it would send my blood sugars down. I remember one time I was on the sofa and my son came over just to give me a kiss on the forehead, and he's like, "Mom, you are sweating profusely." And I had already bought myself a meter just to keep an eye on things, and it was like um, my blood sugars were at 49, and I was feeling horrible, obviously. So I got those under control. And, my husband being a type 1 diabetic, I kind of knew signs to look for with low blood sugars on occasion and all that. But I wasn't smart enough then to change what I was eating. I just made sure I ate more protein and tried everything, tried to find, and I'm a cereal lover. And it was like trying to find any type of cereal that didn't have a lot of carbs is impossible, by the way. It's just absolutely impossible. So fast forward 2020, the world is shutting down. And my sister had researched diets because her daughter was diagnosed with fatty liver disease, non-alcoholic fatty liver disease. And she found keto in June, and she kept putting out hints for me and our other two sisters to start and do this with her. Well, I took the bite in September of 2020. I started strict, straight up keto, 20 total carbs or less. And within 22 months, I had lost 100 pounds. Staying keto. I had suffered, not really suffered, but I had battled high blood pressure since I was a teenager. So 50 years later, on 50 years of medication, I was able to get off blood pressure meds. And that was like, to me, that was the biggest victory of all. When I started keto, I was about probably about 280 pounds. When I hit that one Wonderland mark, I was like ecstatic. I hadn't seen that even after gastric bypass. I never got under 200. You know, you lose the weight then, and then you eat what they tell you to eat, and it just creeps right back up with the whole grain pastas and the dark breads and the sweet potatoes instead of white potatoes. I mean, just all the garbage they tell you to eat is still carby food. So the weight just comes back, just like any other roller coaster diet, except that was supposed to be a life change for me. You know, I have family history of heart disease, high blood pressure, diabetes, so many things that I was trying to run from back then. And I felt that was my last resort. I was in my 40s, something like that. And my husband he's like, you know, I love you the way you are, but if you want to do this, I'm behind you. And that was with the surgery. So when I started keto, he wanted no part of it. He's like, nope, not doing it, not doing it. I had a house of 7 people and I did all the cooking. I was the only one doing keto. So whatever protein I made, everybody ate. If there was a vegetable side that I wanted, that's what everybody got. But if they wanted potatoes, rice, and all that, I cooked it. Didn't mean I had to eat it. And I didn't. I mean, I went 90 days and I have a bad sweet tooth. That's like, it's bad. I went 90 days without anything like that, nothing. And I felt so good. And it was like, then I, you know, started making my own little treats, which were fine. But it's like, I stayed keto, more ketovore, very meat heavy. And I've always loved meat, you know, but it was always, you have a potato, you have a vegetable, and your meat. But when I was young, I always saved the best for last. So I would fill up on the potatoes and the vegetables, and then I would eat the meat whether I was full or not, because that was my favorite part. That's what I did. And it was like, I don't know, getting off the blood pressure medicine after 50 years is huge. I mean, that was like such a game changer because like I said, I battled it since I was a teenager.
How many medications were you taking for blood
Very
pressure?
few. Just one.
Wow,
Just one.
okay.
And it was a very low dose, but it was consistent, you know, for years and years. And, you know, I have to say I was really, really lucky because I didn't feel bad. But they say high blood pressure is a silent killer. So it's like, regardless if you feel good or not, if it's there, it's a dangerous thing. So when I started keto, I went to my doctor and I told him I don't pull punches. I tell him exactly what I'm doing. And he was so 100% behind me. And he said, you do what you got to do. I asked for an A1C check that I don't remember ever having one before then, even though at one point I was up to almost 300 pounds. It came back at 5.8. When I went back to the doctor to discuss the results, I was freaked out because that was above normal range. And I'm like, now by this time I'd been watching Dr. Berry and all these doctors, Dr. Sivis, and I mean, just so many people. And at that point, I had already lost 20 pounds. Probably all water, no problem. But I lost 20 pounds. He's like, I'm not worried about you because you're doing exactly what you need to do. And I just kept on. Within 3 months' time, my A1C was down to normal at 5.4. And he's like, you're good, you know? So off of blood pressure meds, no longer pre-diabetic. And to this day, I started when I was 62 years old. So if anybody says they can't do this as you get older, believe me, it is all possible. I am now 67 years old. Overall, I feel way better than I did then. And it's not that I felt bad, but I knew there were issues. I have way more energy now than I did then. I quit bowling. I started bowling when I was 9 years old. When I was in my 40s, I was so messed up with knee issues and arthritis in my back. I had my knees fixed. I had both of my knees replaced, but the arthritic back, no problem anymore. It's gone. So, and then 20 years after I stopped, I got back to bowling a couple years ago, bowling 3 leagues a week. That uses muscle, let me tell you. Some that you don't think about until you actually go back and do something. But the only prescription medication I am on is a diuretic because I have lymphedema in both of my legs, primary and secondary. And the secondary was caused from the surgeries. And I wound up with my left knee getting infected and had a wound vac in place for a while. I was on IV antibiotics for like 6 weeks, oral antibiotics for 8 months, and 2 subsequent surgeries after the knee replacement within months. So within 3 months, I had 3 knee surgeries on my left knee. But now everything's great. The other thing I do take are vitamins because after gastric bypass, the first thing they tell you is your body cannot absorb the vitamins from your food. You're going to have to supplement the rest of your life. And I have them checked all the time. My vitamin levels are holding steady. I have no problem taking supplements. And I know they say, oh, you shouldn't have to. Well, there's certain cases where you do.
Well,
And
in your case, I would agree that you have to because
Mhm.
you had an alteration in your normal anatomy in the stomach and intestines, your gastric bypass. I don't know which type it was, but usually when you alter the walls of the intestine, we have things that are better absorbed in the stomach and they're better absorbed in the small intestine. And when you mess that up, then you're not going to be able to absorb everything that you need to absorb as far as nutrients.
Right.
So, yes, it is a common recommendation. Maybe on those who are keto or very low carb or even carnivores, you're supplying a lot of the nutrient dense food, but I would say I would agree with you to continue that. I don't
Yeah.
think there's any harm in that,
No.
although a lot of those vitamins are synthetic. They're not the best. The
Right.
best come from food, but uh, it's one of the things that you have to do. So,
Right. Right. And
um,
I was straight. They were straight up about that. And, I have I can't stand things that taste bad. So, if somebody gives me a liquid type of medication, it's like, no, it's not going in. Nope. It's not. It's going to come right back out.
would you, if 2025 Cindy could go back to talk to 2007 Cindy, would you try to persuade yourself not doing the surgery?
Knowing what I know now, absolutely. And knowing the repercussions from the surgery, 100%.
Yeah. Whenever
It
I
was
have
the most,
found,
it was the
go ahead.
most invasive gastric bypass. So where they cut off part of your stomach, they staple it, reroute your intestines, all the things. And but before you have this, you have to go through a psych evaluation, all these support group meetings, and all this stuff.
Mhm.
And I was ready. I was like, I want to get this done. I don't want. It's funny when I think about it now. I don't want diabetes. I don't want high. I don't. I want to get rid of the high blood pressure. I don't want um, diabetes. I don't want heart issues. Well, it was like after hearing Dr. Berry, and I don't know if you personally have heard my story about that, but after hearing Dr. Berry repeatedly say everybody needs to have their CAC score checked. Well, I did in June of 22. And all I can say, that's my husband, by the way, Dale 38S. My first score came back at 5,552. And I I know instantly my blood pressure was up, because then I researched and it says you're in the 95th percentile, somebody to have a heart attack. I'm like, this is great. I've lost 100 pounds. I got off my medication and now this. So I'm like, and I know it was what I had done to myself with the high blood pressure issue. And I don't doubt it a bit.
Well,
I
the high
had
blood
caught,
pressure, and obviously the previous diet. As much as I would like to think that everybody can reverse any calcification in the coronary arteries, uh, not everybody can. We know of multiple people being able to lower their CAC score, but maybe it's not. And the people with the longest amount of time being hypertensive are probably going to have some level of atherosclerosis, because the high blood pressure keeps pounding the walls of the arteries, particularly where new branches take off. We call those bifurcations. And that's the highest point of flow. Just imagine a hose, you pinch it, or you're trying to bend it, you're going to have a lot of turbulence there.
right.
And you're going to develop plaques, and they're going to calcify. So your score is not a surprise.
No.
You
It was when I got it. It was,
Well, I understand. I understand. And,
but
uh, but
then I
what
saw,
we've done all through our lives
uh,
until we change the diet, fortunately, I think we can stop it in its tracks, and there's certain things that might help you to reverse it. But this is one of the things. You have reduced your chances of stroke, heart attacks, and multiple other things just
oh
by
yeah,
changing your diet. You were pre-diabetic at 5.8. You had already started. We don't know what the number was before,
right.
but let's say it was 6.5. I mean, maybe you were already diabetic.
Yeah.
We don't know. And studies have shown that as long as your A1C is 5.6 or less, your incidence, your risk for cardiovascular events, all-cause mortality, and cancer. And there's one particular study, I don't have the graphic right now, that shows that after 5.6, all those things take off very sharply. So I don't think pre-diabetes is a good term. I think we need to, and I told Dr. Berry this personally the last time I saw him, uh, that we should do away with pre-diabetes and call this something else, maybe diabetes, uh, type 2 diabetes stage 1. And
Oh wow.
because
Yeah.
because at 5.8, your risk of developing cancer, of dying from any other cause, or having cardiovascular event, the graph is taking off, not
Right.
in a linear manner, but just taking off sharply,
Yeah.
increasing your risk of those things. So
Well, since I
doing
had the
this,
first test,
I'm sorry?
after I had the first CAC score test, I was catching a live stream with Dr. Berry and Dr. Ovadia. And I asked a question, told him about my scores, because like I said, I was freaked out. I'm like, what the heck? Because I'm seeing everybody get their scores in a 0, or they're freaking out when it's 100. And I'm like, that's nothing. Trust me. So then, thank you, Larry. And I asked about it. He said, use that as your baseline since you've never had one before, and repeat it in a year. So June of 23, I repeated it, and the score came back even higher. It was 6,127.
What was the first number?
5552.
Okay.
5552.
So
So then I
they
caught,
went up about 10% or a little bit
10%.
less. Yeah.
Well, then I caught Dr. Ovadia in a live stream with another YouTuber. And I was able to ask him about it again. And he said, typically as you age, your CAC score can increase 20%. And I said, well, this was 10%. I take that as a win, and I will never have another one done because it's too much of a stressor for me. And I'm like, I am not going to go back to raising my blood pressure because I get these astronomical scores back. You know, it's not worth that to me.
And at this point, I don't know if you have had a CT angiogram, but at this point, a CAC would probably not be as useful as doing a CT angiogram with an AI overread, because it will also give you the calcium score, but it will also tell you about soft plaques, hard plaques, and
Right. Well,
but
I'll tell you,
if you're not
when
having
I had those,
symptoms,
I'm sorry, go ahead.
no, if you're not having symptoms and you don't, you're already doing one of the things that's going to impact your chances a lot more than any medicine would.
Right. Oh, I had when I had the CAC test done, I was going to one cardiologist who was just ridiculous. When I first went to that office, they were trying, writing down in my chart about me because the first time there. And I told them that I had taken a statin years ago, like 25 years previous, for a very brief time because it bothered my muscles where I couldn't raise my arm without being in pain. So I quit. And when the doctor that gave it to me back then, I said, I'm not taking that anymore. So that's that. They put in my chart, allergic to statins, right? Well, the doctor himself comes in after his nurse had just marked my chart. He said, I think you should take a statin. I said, I think you're crazy. I said, did you not read your chart? He said, yeah. I said, well, the answer is no. I will not. A year later, after I had the second CAC done, he had asked me the same thing. And then he says, you can't deal with a little pain that came along with the statins. I said, man, I felt like giving him a little pain to deal with, but it was like, it's all good. It's all good. Well, I now have another cardiologist, and he has done a echocardiogram. I was on a heart monitor for 2 weeks with no episodes. The echo came back with a couple valve leakages that are pretty normal. He said, just repeat it in 2 years. He said, you're good. So I'm like, all right, I'm going to take that as another win, and I'm good. So the only thing I had been getting, and they're not as frequent, but they still exist, is I get palpitations once in a while. And one time, the worst one, I wasn't even doing anything, and these palpitations came on at 200 beats a minute for like 10 minutes straight. And I'm like, if I go to the hospital, by the time I get there, they're going to be done, because they typically come and they go as quick as they came. But that was the worst. And I used to get them a lot more frequently before keto. Now it's like, it's not so much. But every once in a while, they'll let me know we're still here. We're
And
still here. But
sometimes it's 200 is high.
yes. Trust me, I felt like my heart was going to jump out of my chest. It was like you could visually see it. It was crazy.
I don't know if it was Sunday or Monday. I woke up. Palpitations woke me up, but it wasn't irregular. And I checked my blood pressure, it was 118. My pulse was 95. The thing is, when my pulse goes over 90, even without hitting 100, I feel it.
Yep.
So I just took a few breaths, and it was
Mhm.
4 o'clock in the morning. And anyways,
Yeah, a couple deep breaths and sitting quietly, and they go away. And it's like I have trained myself to that effect. So even I've trained my husband at this point, because if he sees me just sitting down and just taking some deep breaths, he said, "You have another one, don't you?" And he just leaves me alone. And within no time, they pass, and I'm good. So, it's, but right now, my blood work is so good. It's like the first time I changed doctors, right? The doctor's office called me. They said, your total cholesterol is a little elevated and your LDL is a little elevated. And I said, what are my HDL and triglycerides? Oh, they're great. I said, then I don't care because I'm good. They
do you
haven't
remember?
bothered me about them since.
Do you remember the numbers
Um,
for the triglycerides and HDL?
Offhand, no, I don't. But they're all, when I average them out, I know it's right in the range that it should be, and even better than that. So, when you do the division, whatever calculation that is, I don't remember. But I should have had them because I have them right there. Yeah, don't mess with Cindy. She won a bowling tournament. Yeah, I entered a senior tournament for the seniors. They have different age brackets. And with mine being between 65 and 69, I took first place for Kentucky in that division, which is why I'm going to Texas. That's the next part of the tournament. So,
By the way, I like bowling just for the experience, going with the family and friends.
yep.
My highest score is probably not even close to your lowest score, so I'm not going to
Well, I
mention
don't
it.
know about that. When I first went back to try, I was so nervous because I hadn't bowled since before my knee issues and the knee surgeries, and I was so ridiculously nervous. I didn't have my own bowling ball or bowling shoes, which make a big difference. And my first game was a 65, and I'm like, I can't do this because I average
Okay,
170.
so it's higher than your lowest, but
Yeah.
it's still not great because I I think the best I've ever bowled was 138. I believe that's the
Oh
number.
man, you got to come up. We'll go bowling. No, my average is
Uh,
a 170, and that's where it was when I quit, like 20 some years ago. So it took me about a year and a half to get back where I needed to be for
yeah,
myself.
Dilly has a comment relating to the
Mhm.
age you started, and basically, it's never too late. There's
Right,
only one time when it's too late to change your diet, and that would be when you no longer have any requirements for any sustenance, if you
right.
know what I mean. Until then, it's never too late.
Hello,
Uh,
Aunt B. Yeah,
so
it's go ahead.
I wanted to ask you about the lymphedema. You say you're taking still diuretic. What other things do you do for that? And
I wear
do you also have lipedema?
I do not. I've never been diagnosed with lipedema.
Okay.
Lymphedema, he said it wasn't bad enough to do any surgery on it, just to wear compression socks. And I have faithfully worn these every day, all day till I go to bed. And woo, it can get hot. This time of year it can get really hot. But the alternative is swollen ankles, swollen feet, and I'd rather not. It's
Do you
I've been
do
able
any?
to manage it pretty well.
Do you walk?
I do. And
Okay.
actually, I just finished one challenge for myself of beef, butter, bacon, and eggs in June. The 30 days of BBB&E, lost 11.8 pounds, 9 total inches all over. And then we started a 10,000 step a day challenge, me with a group of people that I'm doing this with. And I haven't always succeeded, but I got to say, I've been not feeling the best. So, I got to listen to my body because I'm and take it easy, But there were a couple days I got the 10,000 in, no problem. Then it was 2 days. It took 2 days to get the 10,000 steps, but I won't quit. And in fact, I just posted a short video a little while ago about just that. If I don't make it, I'm not going to quit.
I mean, 5,000 in a day is still a very good amount.
Uh-huh.
If you did 10,000 in 2 days, that's great.
Mhm.
Depending on the stride, the length of your stride.
I'm short.
Well, I know. That's why I mentioned it,
Yep.
because we cannot tell how long that was. But do you know how many miles you walk? If you walk a couple of miles, or
I will look it up. How about
okay.
that? I know it's probably been it was about 4 miles maybe.
Okay.
Let's see. We'll do yesterday. I had 8,414 steps, but the day before I had just under 1,600. So again, it took 2 days because I was on the couch sick most of the day. So it was like, now this doesn't tell me. Damn it.
It's okay.
But
All
it's
right.
been like, from what I've seen, it's been about 4 miles, give or take. I mean, we have a great neighborhood to walk in.
Mhm.
It's extremely hot, but we have a great neighborhood to walk in. There's hills there, there ups and downs, and it's great. So yeah. But
We have
while
a
I was on
comment. We have a comment by Bill Stevens. I was
yeah,
diagnosed last week with type 2 diabetes. He means
yeah.
my blood sugar was 600.
Woo.
That's very high, sir. They gave me metformin, 1,000 milligrams a day, made me sick as a dog, stopped after 3 days, and went full carnivore. And my blood sugar is going down gradually without that poison. All right. So, a couple of comments here. I'm not your doctor. You're not my patient, Bill. I am glad you're going at least the right way now. 600 is very dangerous. Okay. That was a one time thing. So hopefully you're checking your blood sugar, or you got yourself a continuous glucose monitor to be able to monitor that. It's not going to happen overnight. So don't expect next week not to have diabetes, but you took the right step. Metformin is one of the most misunderstood medications out there because of a couple of things. Number one, side effect, number one and number two is GI in general, and particularly diarrhea. Almost 50% of people with taking metformin have diarrhea. That is 1 in 2. Okay. The number
Wow.
is like 45%. However, when you use the extended release metformin, that number goes down to 8%. So I never put people on metformin by itself. I usually don't use the immediate release unless the patient had already used it and they tell me, no, I tolerate it well. Okay. But otherwise, I always put people on extended release metformin that need it, because instead of 45 to 50%, only 8% is going to develop significant side effects for me to probably discontinue it. Number two, among all the medications out there, it's probably one of the most benign as far as the side effect profile. The biggie is the GI problem. One thing that is very misunderstood, and I find that online and the internet, a bunch of comments from even doctors. And unfortunately, I have to call out my own profession because these doctors are ignorant when mentioning what I am going to mention. Because one of the misconceptions is that metformin causes kidney problems. Metformin does not decrease the function of your kidney. Your renal function is not affected by metformin. However, if your renal function is decreased, the dose may need to be adjusted because the as your renal function goes down, metformin may accumulate in your blood and cause a rare condition that is a metabolic acidosis. And it is so rare that in 41 years, I have never seen it. And I've worked in emergency room plenty of that time. It is very rare. But because of that, the association between metformin and chronic kidney disease or decreased renal function, particularly we look at the EGFR, which means estimated glomerular filtration rate. If that number is going down, then you adjust the medication, not because the medication is going to cause renal dysfunction, is because the renal dysfunction may increase your chances of having a very rare reaction. So for that reason, the recommendation has been to either decrease it or eliminate it, depending how severe your chronic kidney disease is. Otherwise, metformin, even though it has a mild action, I consider it mild compared to other more potent medications, but it has a very okay profile. It decreases your GI absorption of glucose. It decreases gluconeogenesis from the liver, increases insulin sensitivity, does all the right things. And it may promote a very weak action on promoting weight loss. So among all the bad, the metformin is less bad. Okay. So
Right. 600 is
yes.
wow high.
So
I mean, my husband, go
he
ahead.
doesn't mention the hemoglobin A1C, which you know it's probably very high, but metformin might be a tool to use until you are having much better numbers. Go ahead, Cindy. You were going to say something about
Yeah.
your husband.
After being with my husband, he was diagnosed at the age of 2 with type 1 diabetes.
Okay.
And after living through with him through all the highs and lows, and he's on an insulin pump now, which has been a godsend for him. But it's frightening. He had gone, there was one day he wasn't feeling well and he called out of work sick, which was very rare for him. And I had to go to work. I said, "Are you sure you're okay?" "Yep." By the time I got home, his blood sugars were up over 1,000. He was in the midst of ketoacidosis. And, people think that ketosis and ketoacidosis are the same. Heck no. Heck no. I called 911. He went right into the ICU for like 4 days. He was still coherent. And they were floored. They were like, "You should have been in a coma." And all this stuff, a diabetic coma. He said, they can't believe that he was still talking. But it's a frightening disease.
What was the blood sugar?
Over 1,000.
1,000. Yeah. And
It was crazy
unfortunately,
high.
yeah, and it can happen. Unfortunately, I've known people who have died within that circumstance, 1,000 to 2,000 glucose.
Right.
Most patients, type 1 and type 2, that die from diabetes, they die from the complications of diabetes, whether
Yeah. And
it
there's so many. There's
yeah,
so many. It's crazy.
but an acute
What?
episode like that, you have to take it seriously.
Yeah. That what had happened that day is he was so sick and vomiting and everything. He had popped his insulin pump out of his skin. So he wasn't getting any insulin whatsoever all day long. He had no idea it had happened. And I got home from work and he was downing water. He couldn't get enough. And I'm like, dude, I said, you got to go to the hospital. No, yeah, you are. It's like, yeah, you are. Because this isn't good. Something's not right. And in fact, we were just out on the 4th or the 5th. We had gone up to Lexington and we came back. We stopped at a casino up there and we're walking around. All of a sudden, he says, I can smell insulin. And that only happens if his pump pops out of his skin. If that line, I said, and he had nothing, no other change with him. And this is not like him. He usually goes prepared anytime we go anywhere. Well, we got the heck out of there. And I was going 90 down the highway to get him home because he didn't have a meter with him to check because, he's so used to his pump and his CGM and, it all does it for him. That I just had to get him home because all I could remember is that day that he was so sick. And I'm like, nope, not happening, not on my watch ever again. But when I first met this man 21 years ago, his A1C was 17. I kid you not. He was so out of control with his diabetes. When we moved from New Hampshire in 2021, it was down to 7.9. And it has now been pretty much holding steady at 6.4. 2 weeks after I started keto, he did too.
Does he eat like you do? Or okay.
He does. That's why I said 2 weeks after I started, he started. And I could see the changes in you that quick. And he had fallen and had to quit his job that he loved, and he was so depressed. And he tells this in his story. 2 weeks after I started, he decided he was going to start eating that way. Within a week, the depression was gone. He was back to being motivated to do the hobbies that he enjoys so much. It still bothered him that he couldn't go to work, but he has other issues going on also. But he gained that spark again, the interest in doing things again, where he didn't. After having fallen and having to leave a job of 30 years and he was just beside himself. It said this man was diagnosed at 2. He's 63 years old and he is thriving. And, when we go out, he has more willpower than I do. He's like, he'd be like, no, we'll go to a steakhouse. And the first thing he says, don't bring the bread. Don't bring. I said, dang.
And it's interesting because my wife is more keto, and she. But when we go out to a restaurant, she'll be the first one to no bread.
Yeah.
You don't want bread? What is it? What's the matter with you? All right. So I want to just mention this comment. Hey, Cindy, how are you? Beautiful.
I am good, Jujubee. Thank you.
And I want to bring up this.
That was about 2 weeks after I started keto. And that was the beginning of October 2020.
So 2020. And the next picture is from when?
I believe it was right after I had lost 100 pounds in 2022, like August, September, something like that.
There we go.
Yeah. We had moved here and my sister, it's funny because my sister had given me the shirt I had on in that picture. And when I first got it, it was so tight. I could not wear it. And it was like in March of 21. So from then to August of 22, it was time to hand it down to our niece who was starting keto. And we handed the shirt down to her because it was too big for me at that point. But it was great. I mean, I thank my sister all the time because without her persistence, I probably would have been stubborn enough not to do it. But, the community is great. And I can't say I've ever done carnivore, with the exception of the beef, butter, bacon, and eggs challenges that I've done to myself, which is like, other than lion diet, the hardest carnivore thing to do. But, I feel good regardless. I successfully lost that 100 pounds on keto. So I know it's possible either way. Did you ever have to take vitamin B shots due to lack? No,
I
I've
think
never had a lack of nutrition.
I think it in a way it is hard. I agree, and in other ways easy because choices are
Just a
actually
few
easy.
things. That
Sometimes
part is, but when you miss things like cheese or other things,
so
it is not.
it is our attachment to a certain foods that
Yep.
our brain still wants us to consume, but the choices are rather easy. And sometimes I always joke around a little bit and I mention it because my addiction problem would not be with something that is not carnivore. It is with something that you can classify as carnivore, and you just mentioned it a few times. Is cheese.
Cheese. Yep. And
Uh,
it's like, it's not, I shouldn't have said it's hard. It is the most restrictive, which makes, like, you're right. It does make it easier. Your choices are simpler until you want something else. But I documented 30 days of beef, butter, bacon, and eggs. Most of
but
them are
see,
short
the
on my
problem is
channel,
up.
what I eat.
The problem is up here in what
Yep.
we want, because
Mhm.
when you stop to think about nutritionally dense food and you're getting everything that you need from those foods, it's just, oh, I could have whatever it is, each
Yeah.
one. Yeah, I'm sure cheese is a problem for many people, or sometimes bacon, but I I don't remember the last time I was craving broccoli.
No. Now, see, that's the thing. I I can do without vegetables, without any problem. My husband likes his broccoli. We go out. That's usually what he gets with his meal, and that's all fine and good. And he does so well, and it's like I, he amazes me. But
we have a
it's like,
question from we have a question
sure,
from Kitchen Witch
Anya.
1895. I want to know the story behind that name. But anyway, question, Cindy, did you ever have to take vitamin B shots due to lack of nutrition? Very often people who
No.
go through gastric bypass surgery, they'll use, but particularly B12 might be a problem with absorption. So no matter how much vitamin B12 you take by mouth, you may not get the absorption that you need, but that's easily remedied by sublingual preparations or by having shots of B12. And
In the beginning, I had to take vitamin B sublingual. Now I take two vitamin B little tablets a week, just two a
okay.
week. But I've never had to have injections. Like I said, because I do supplement with the vitamins over, every day, I don't have, I don't have any issues. All my blood work comes back so good. My doctor even says to me, "Your blood work is better than mine." And I look at her and I said, "What does that tell you?"
All right. So Shari from Nevada, I guess.
Her pup was Nevada. She actually lives in Arizona.
Okay.
Yeah, the dog in the
Why does
picture was her.
why does someone need a CAC? Do you want to take a stab at that?
I just went by what Dr. Berry said, that everybody should know their numbers and all this. Personally, I said I'll never do it again, even though he told me at KPL, at Keto Palooza, when I went to talk to him, he said, you really should repeat it every year. I'm like, no, it's too much of a stressor for me. So your expertise, Dr. Nelson.
Okay, so let's go back to your regular doctors. And what is the main thing that everybody wants to know? Because they think they're going to save your life by giving you a pill that's going to lower it. What is it? Cholesterol, right?
Mhm.
Uh, regular doctors are going to think, oh, I got to know your cholesterol. And if you have 201, you're going to drop dead from a heart attack. Well, that is not true. However, when you go to the doctor, all we're doing is trying to assess your risks for having something, right? Cardiovascular disease. We try to do screening for cancer. All these things are to decrease your risks of having something that could be fatal, for example. And that's the reasoning behind the cholesterol testing. Although I, I know I'm not speaking to the right crowd here if I mention that word, because nobody cares about the total cholesterol, really. And rightfully so, by the way. However, if a doctor tells you, oh, your cholesterol is 250 or 300, or your LDL is this number, then your next question should be, well, what are we trying to do here? What does lowering my cholesterol would do? And in their mind, it's going to be decreasing your risk of a heart attack. Well, how about trying to determine if I have the disease that's going to cause the heart attack, the stroke, the amputations, by doing some testing to see if I already have that disease. This is where the CIC score starts. Coronary artery calcium. It's a very non-invasive test. It gives you sort of this. I would consider it just a screening. If it's any number other than 0, then the next steps will be to try to determine if you actually have any significant, because you already have coronary disease if you have anything other than 0. It is whether it's 1 or 100. Mine is 165, by the way. So you already have some coronary artery disease. The question is this going to kill you or not, and how imminent that is? So then you go down the additional tests, which may include a carotid intima media thickness test, or may include a CT angiogram with artificial intelligence overread to see how significant that is. And then we go down the road trying to assess risk. That's what all we're trying to do. If I
Mhm.
find you're very high risk, then I offer some interventions. So this is why it might be important to have it. So among carnivores, for example, I'm not going to tell you test your cholesterol, because most people are going to not want to do it. Uh, but everybody should have an idea of what their fasting insulin is, where
Mhm.
your blood sugars are, your A1C, and if you're concerned about having coronary disease, because it is one of the top causes of mortality. People die from heart attacks, strokes, and multiple other things. They get amputations from atherosclerosis. So you want to know where you are. You want to know what your fasting insulin is. If you never had it, that will be a good test to have. The A1C, all these things give us an idea of our risk much more than having a high LDL-C. If you want to be more specific, if you've listened to Dr. Obedia, uh, then you want to know the quality of your cholesterol, and the test for that will be an NMR lipoprotein fractionation, and you want to see if your LDL cholesterol is big and fluffy or small and dense. That's another time for another time. But this is why, if you're concerned or your doctor is concerned, this will be probably the first test to have. If you have a score of 0, your chances of having a heart attack or even
You're
a
going to
stroke,
live forever.
well, no, I wish that was true, but your chances are
Well,
going to be greatly decreased. And then you can say to the doctor who's offering you the statin, but if my CAC score is 0, why do you want me on the statin?
yeah. Well, when that a cardiologist wanted me to take a statin, after they had said I was allergic to them because of the problem I get taking them, he didn't talk about my lipid panel at all. Barely addressed the CAC results. Just wanted to give the medicine. And I'm like, I'm not taking it. My my total cholesterol ranges around 240. I don't care. I don't care. My LDL is maybe around 140. But like I said, the triglycerides are way better than normal, mid range. Same way with my HDL. I did have a fasting insulin done once and a C peptide, and both in normal ranges. So I'm like, I'm good. I'm good. And as long as I feel good, you know, with the exception of a little stomach bug that I've had for a couple of days, but I'm good.
All righty. So Sherry says that she's safe.
I just love this girl. Let me tell you, she has, she's in the chats all the time with us, and I appreciate her so much. She has, she's been vegetarian. She's just starting to eat meats. The more she listens to us and the more she's with us in the chats, but she will never eat a steak. Never, ever. That's it. Nope, no way. But she's great. She's really great.
Unfortunately, there are people like that, and the truth is the brainwashing we've had for the past 70, 80 years, that, low fat everything and plant-based this, and, steak is going to kill you or cause a heart attack or cancer. And sometimes it's difficult to overcome that.
Yeah.
Dr. Kit Nelson, has anyone left the doctor's office with a good CAC score and died shortly after within a month? I don't know those statistics, but heart attack is not the only cause of death. When I speak to people, a little bit jokingly, I tell them, well, I don't know if I'll be here tomorrow because I could die from anything.
Anything.
I could cross the street and be hit by another car. We all have risky things that we do. Last time I went to the doctor and I was asked, well, do you participate in any risky activities? And I said, well, I like to argue with my wife.
That's risky. But I'm a firm believer that our fate is determined for us anyway. And everybody's going to go at some point. We never know what it's going to be of, when it's going to be, what you're going to be doing, where you're going to be, anything. When it's your time, it's your time. The only thing, in my opinion, that you can do is live your best life at the moment. Yesterday is gone. Tomorrow is not a promise. You got to live your best moment, every moment of every day. And
so
one of
the Dalai Lamas once said, and I think I like this quote. I am paraphrasing because I don't remember the exact quotes, but he said, there are 2 days this week that I cannot do anything about. Okay, 2 days this week I cannot do anything about. Yesterday and tomorrow.
Mhm.
Okay. Now, um, if you really want to hear about cholesterol, how it causes heart disease and coronary disease, not, but you want to be tomorrow morning at 6 a.m. in our Kilts. It's on YouTube, on your Kilts channels or my channel, Alia. We all retransmit the live streams because we are going to have Dr. Malcolm Kendrick tomorrow. He is from the UK. He's been a doctor for a long time. He wrote the book, The Clot Thickens. And while I was reading the book, I sent him an invitation. So he's going to be tomorrow in the 6 a.m. live stream with us. I believe he also wrote the Great Cholesterol Con or something like that. He's a self professed cholesterol skeptic. There is a society of that, uh, of cholesterol skeptics. And I think most people here are probably at heart cholesterol skeptics. So we're going to have that discussion at 6 a.m. in our YouTube channels. Thank you, Cindy, for being here. I
Thank you
put,
for
well,
inviting me. I appreciate it.
oh, you're welcome. So you can find Cindy. You can see it there. That's your YouTube channel, right?
Yep.
Okay. And she also has a Facebook group. And I didn't, most of you are watching on Dr. Kill's channel. I was not able to put it on that uh, show notes, but I do have it in my personal channel at The Real Dr. Nelson. You can go there. You can click on the Facebook group that Cindy
That's a
has.
keto page, but we support every aspect of the proper human diet because it's
All right.
all the ketogenic way of eating. On my channel, I bring on people like Dr. Nelson's going to come on when he frees up his schedule. And I have met some of the most fantastic people by doing these live streams. And it's why I thank you so much for inviting me on today.
Oh, thank you for being here. We love having people who have had successes uh, because when you're able to tell others what you have done and why you did it and how you did it, I think it helps. Some people are going to identify with you and say, oh, I had the same thing, maybe I can try that. And this is, did you ask your doctor's permission to start on a keto diet, Cindy?
No, were you kidding? I'd never even mentioned it to him until after I started it. And then I told him, and he said, okay, that's good. I've never had, and I feel really lucky because I hear a lot of people have problems with their physicians and, well, just don't tell them what you're doing. Well, I have had that I guess the good luck that my doctor in New Hampshire was just the best. We wanted to pack him up in our suitcase and move him with us because he was fantastic. But also the one that I have now, she's an APRN. She's great. She listens. And I'm trying to change her way of eating because every time she tells me my blood works better than hers, I'm like, that's not good. But
All right.
yeah,
So
it's great.
thank you everybody for being here. We went over the hour. So again, thank you, Cindy. And we'll see you tomorrow morning, Dr. Malcolm Kendrick. I'm very excited about his presentation. And if you have questions about cholesterol, he's one of the people to ask. Okay.
Very good.
So you have a good day, everyone. I'll see you tomorrow morning.
All right.